when it comes to a government-run health care plan. Focus group guru, hugely respected political observer, Frank Luntz, joins us now. He's got a new book called What Americans Really Want.
Really?
Yes.
Really?
Welcome to the show. So that's just it. First of all, try and provide some clarity here. We don't understand what the public option is because there are 8 different public options. What is it that we want? What do Americans actually want when we say a government run?
The first thing we want, can you hand that to me for a moment?
Yes, I can.
The whole thing?
The whole thing.
Eric, can you carry that?
Careful, Eric, careful.
Don't drop
Careful,
it.
don't hurt your back.
That is 1990.
1990 pages. And I probably just cut my microphone off. Do you realize that the average American could not lift this, let alone read it? The first thing that we want is to know what's in this legislation. There's no way to know. By the way, this is actually breaking my leg. Can you take it?
So then, Frank, what do we do about that? I mean, can lawmakers explain something simple to, or is this health care reform? It's a complicated subject, so how do you whittle it down to 400 pages?
It's not an issue of whittling it down. The first thing that the Americans want is for the medical profession to be making the difference in this legislation, not politicians. We don't want Republicans handling this. We don't want Democrats handling this. We want doctors and healthcare professionals. Second is they want that simplified. You know that 1,900 pages means a bureaucracy that is absolutely out of control. Third is that we want it to be cheaper. You don't know what the unintended consequences are in that 1,900 pages. I wrote What Americans Really Want, to simplify our priorities in life. That is complicating them, and I can tell you that the American people are going to turn against that.
Frank, tell us, is it partisan? I mean, is it Dems want national health care reform and Republicans don't? Where do the numbers show?
Everybody wants health care reform, regardless of whether you're a Republican or a Democrat. They believe that the 30 million American citizens deserve to be covered, and they don't believe that there should be pre-existing conditions that prevent them from this.
Right.
That said, that's it. They don't want a government option. They don't want government-mandated health care. They don't want some bureaucrat to be between you and your doctor. And they don't want medicine dispensed in a government agency. They want it dispensed in the hospital.
But you just said that we want access for the 30 million Americans that don't have it. So what's the mechanism by which we do that? Apparently the free market doesn't exist for Republicans and Democrats, so that's off the table.
Why doesn't it? If you
we got to get rid of the Republicans and Democrats who are writing the bills, apparently.
What you do is you give real competition, which means that every insurance company has the ability to compete in every state. That changes the whole process. And that may be complicated.
Antitrust. No, we've been talking about that a lot on this show. Do away with that antitrust exemption. Okay, aside from health care, name another big issue that you talk about in this book that Americans really, really want.
Americans really
want. Or there's only 2 reallys.
Americans, no, if you want to add the third really, it makes it really likely that more Americans will really buy What Americans Really Want. So I'm going to plug the book 5 times really well in about a 30-second. They want for their kids. Look around. I don't know if the camera can get the people who are around here. I bet most of these people make hundreds of thousands, if not millions of dollars a year. And I wonder how many of them, like that guy right there, I wonder how many of them are good to their kids. How many of them are doing those things that are necessary for their kids to grow up happy, healthy, drug-free, and alcohol-free. I'm going to give you the 6 things that are necessary because that's what really matters to us, our family. Number 1, got to have dinner with your kids 5 nights a week or more. Number 2, got to take them to church or synagogue once a week or more. Number 3, check their homework 4 nights a week or more. Number 4, demand that you know where they really are on Friday and Saturday night, and they better tell you the truth. Number 5, if I got it on me, take your BlackBerry, take your kids, and go away for a week. Here it is. And what you want to do with this thing, not only shut it off, but you want to throw it away. Because the more that gets in the way of kids, the worse that it gets. I hope it didn't break. I'll throw yours now. And 6, have your kids participate in a team sport. We really want our children to grow up happy and healthy. Those are the 6 ways to do it, and that's all in the book.
I'm buying the book based just on that, just for that.
Frank, real quick, this thing right here, this 1,990 pages, what is that going to do to the November 2nd, 2010 elections? Are the Dems are they going to lose seats? What's the effect?
I've tried to avoid prognosticating, but if that's the legislation that passes, the American people are going to say enough is enough. I don't think it's going to have a huge impact in the Senate. Maybe a couple seats change hands. In the House, you can see 25 or 30 seats go. I was involved in 1994. I know what happens when the American people get really angry. 72% say that they're mad as hell and they're not going to take it anymore. That's going to make them even angrier.
And this time they're going after both the Republicans and Democrats.
We didn't have a chance to talk to you about the third-party resurgence, so you have to come back.
Got to come back.
Only we can break cell phones.
Can we do this real quick? Can we ask the Bill how he's going to pay for himself?
Taxes!
That's right, Rebecca. That's it. I was
You hear
waiting.
that?
Hello?
Taxes!
Frank Luntz.
I didn't realize that the bill was a female. Wow.
Female power!
Well done. Thank you, Frank.
Really, really.
All right, guys, on tap, Mylan.